We're going to let people get in here and then we'll get
Mhm.
rolling this morning. Oh, and I forgot to ask, I'm turning it to you, Kim.
Yeah, once you talk through
Okay.
the slide 3, then yeah, you can hand it over to me.
Okay. All
Mhm.
right. I think we've got people in. We'll go ahead and get started. Welcome to the EQIP Subgroup meeting for May 15th. Obviously, this is an exciting meeting because we're going to be talking about a couple big issues. Did want to remind everybody today is the deadline to turn in the supplier information through the Meredith email. So if you haven't done that, please do that. You'll probably get reminded again.
Mhm.
Very excited because the Chris team has got a lot of work today, and we're going to hear about the new episodes for PY6. And actually, it looks like they're delivering a little more than what we originally said before. So that's really exciting news. So it's going to be a good meeting and a lot of good information. So I guess the one thing that I'm talking about this morning is the QPP issues. And just so everybody knows, MedCai, the HSCRC, CRISP, we're all working very hard on this QPP problem and the issue with the early years and the fact that people have been penalized and they haven't been paid. In fact, we had meetings as recently as yesterday with the congressional staff and the governor's office and others, and we are trying to get relief. The matter is not resolved, so while we don't have any new information, I just want you to know that we're working very, very hard on it, and we're trying to get some type of solution to this problem. We know it's a big deal. We understand, having penalties that you shouldn't have and not getting paid money that you're owed by a contract you have is very frustrating. And we're working through the issues and we're dealing with it. The other thing that we're doing is we are double and triple checking. And I know Kim and Krista and everybody is working really hard to make sure that the 26 numbers are right with CMMI, and we're going backwards for the prior years where we haven't had reported problems yet as well. So that's kind of where we are. As soon as we get major updates or information, which hopefully we'll have sometime in the next couple months, we'll make sure we email it to everybody on the equip list, or we'll give it at the next meeting. Again, like I said, we're literally talking about this problem every day, and we're taking it very seriously. So I don't know if anybody has any questions they want to ask. I'm happy to answer them. All right, I don't see any, so I will go ahead and turn it over to Kim.
Awesome. Okay. Good morning, everybody. Thanks for joining. We are going to start off by talking about PY6 application prep. Okay. So this is the timeline. We are in May, so we're currently in the pre-enrollment phase of EQIP. And I'll go into more detail in other slides about, the onboarding template and the pre-enrollment form. But just know that these are new tools that we've developed to help the entities have a much smoother transition this year into doing the actual application itself. Essentially, we just really want to encourage everybody to start doing, pre-application activities now to avoid delays during the enrollment phase. So what do we need to do to get ready? So right now, we really need to emphasize and start really digging into how we're going to structure our entities for PY6. So take time now to start intentionally thinking about that. For those of you who are new to CRISP or are considering creating a new entity, this is not something you want to wait on. Like you want to get on this right now. We want to ensure that everybody has all the accesses that they need, ideally before August even starts, so that there is no issue in doing the application process. Again, we have a couple of tools to make this process easier. One is the pre-enrollment form, which I'll go into much more detail later, but really this is the first step if you are new to CRISP or you are creating a new CRISP entity. Um, and this just helps us get you set up quickly with all the necessary accesses so that it prevents delay for your actual enrollment. The second tool that we are offering, which we have been offering since the beginning, but it may not be as widely known, is something we call the MPI episode summary file. And this is another very valuable resource which will provide you information about which providers you may want to put into your entity and whether or not those providers have actually triggered any episodes during the baseline year. And that's really important because it allows you to take like a data-driven approach to structuring your entity and making sure that you are meeting all the EQIP participation requirements. So I want to take a minute to emphasize the importance of the pre-enrollment form here. And you're going to hear me say this a few times throughout this presentation because it's really, really important. We do have a deadline for this pre-enrollment form. It is critical that it is submitted to us no later than August 7th. And the reason behind that, we're not trying to be, sticklers, like it's not, we're not trying to be arbitrary. There's a significant amount of work that has to happen on the back end for us in order to make sure that you have all the proper accesses that you needed. We have to establish your entity access to the HIE portal. We have to credential you access to the EQIP portal. We have to make sure all of your users have all the permissions that they are needed so that the actual application process can flow smoothly. So if you are brand new to CRISP, to EQIP, or if you are creating a new entity this year, we need you to fill this form out and then make sure that it is to us no later than August 7th. It's a hard cutoff. And again, we're not trying to be sticklers, but we just don't want you to wait till the last minute because if you submit it to us after August 7th, there's just not going to be enough time to get you all the accesses that you need. Now, for those of you who are returning entities, this is now the time to sort of take a moment and pause and reassess. Start by reviewing your current care partner list, making sure that this is the exact group that you want to move forward with in PY6. Can start taking a look at your PY5 performance information and your PY4 if you were in PY4 as well. Are there episode categories that you are performing well in and you want to continue? Are there areas where it might make sense to add or even drop participation? And just as important, begin meeting internally with your care partners now. This is the time to take this opportunity to make sure that all the care partners, all the people that are involved in your entity, all align on your strategic goals. Identify transformation opportunities where you can make differences and perhaps not only improve patient care, but also cut costs. And then most importantly, make sure that everyone who is within your entity understands what participation in EQIP actually requires. Don't assume that all your care partners even remember that they're in the EQIP program, because that often is the case that sometimes we'll say, oh, you're in the EQIP program. And they'll be like, what? So anyway, just take this time now to make sure that you're thinking about how you're structuring your entity for PY6 and then start aligning with your entity, making sure that everybody is all on the same page and that they understand what those requirements are. Just reset expectations, etc. This will put you in a stronger position when it comes time for when enrollment opens. Okay. So entity readiness. Let's start with roles. This is really important, especially if you're new in getting set up properly. You're going to want to identify a lead care partner and an administrative lead. The lead care partner is extremely important for a couple of reasons. They are not only the individual who actually has to initiate the EQIP application, but they are also the person who is ultimately responsible for the entity itself, right? They're responsible for the participation. So it's critical that whomever you choose as your lead care partner is ready and willing to take that on. They are also included in every single piece of communication that comes from the EQIP team, because we as the EQIP team and the EQIP program have to ensure that they are clearly aware of everything that is going on. This is a policy of the EQIP program. Then you're also going to want to assign or potentially assign. You don't have to have one, but it probably will make your life a little easier to have an administrative lead. This person can and or will be responsible for managing the day-to-day EQIP program, getting into the EQIP portal, tracking your progresses, maintaining information, handling ongoing updates, etc. So it's important to have those two things designated. Then you want to make sure that when you are building your entity, every care partner must have an active PCOS record and be in good standing with CMS in order to participate in the program. You don't want to wait until the last minute to check this. Now, check it now, verify it now. And your care partners can log into PCOS. They should revalidate their information, ensure there's no compliance issues. And in addition to that, they can also log into the NPPES website to make sure all of that information is accurate and up to date. Any discrepancies in either one of these portals can prevent them from being able to participate. Okay. Then let's talk about eligibility enrollment. So the entity must, if you have several episodes, you must have a total of 50 episodes across all clinical categories within the baseline year. That has been, I'm sorry, let me rephrase that. You must have at least 50 total episodes across all clinical categories within the baseline year. If you're only participating in one episode, you have to have at least 11, right, per category in order to participate. And then most importantly, with your entity construction, 75% of your care partners, your NPIs, must have triggered at least one episode during the baseline year. Now, if you're smaller than 10, like if you have 10 or less NPIs, then that threshold is reduced to 50%. But anything like 11 and above, 75% of your care partners must have triggered at least one episode within the baseline year. Now, you don't have to guess, right? That's one of the purposes of the MPI summary episode file that we have. You can request this MPI episode file and it will provide you that detailed information. It will show you how many episodes that you can actually participate in. It will show you how many MPIs have triggered claims in that episode or in any of the episodes during the baseline year. And I'll walk through that a little bit more later in the slide deck here. You can also wait until the portal opens and you can look within the portal. So in the system, it'll show you which episode categories that you qualify for based again on the historical information. So now's the time to kind of be a little proactive and start reviewing your data in advance. Take the time again to align on all the roles on the CMS records, confirm eligibility, etc. If you get all that done now, when the enrollment opens, you're ready to go. You're ready to hit the ground running. Okay. So we encourage, oh, wait a minute. I see a couple of questions in the chat. Let me come back here. Regarding CMS vetting, we had a provider that was removed from EQIP PY5 because CMS made an error. Yeah, we are aware of that. Krista, do you have any insight or any help that maybe would help the entities understand what they need to do to avoid the errors that they had in the validation? So this entity had a provider that was removed because of an error. CMS had made an error.
Yeah, I think sometimes there are just things that can't be avoided. They're just things in their system. I mean, unfortunately, there's just glitches. So I think we will be really proactive. As soon as you find that out, you notify us. We will reach out, do our due diligence. So I just make sure, go in and make sure literally every single number you've double checked and checked multiple times, make sure everything is accurate, do the best that you can. And then, that's really all we can offer. But we can certainly, as soon as you have an issue, reach out to CMS and try to figure that out. Sorry that there's not a better answer, but I think sometimes there's just flaws in the system. So hopefully we can avoid all of that. But please reach out.
Okay. Charlotte, you said if we don't want to change anything, any providers' episodes, do we have to do anything to complete anything? Yes, you must still log into the portal and just go through your information, just validate and verify. There will be, and I'll go through this later, there's going to be updates within the portal that you now have to hit a submit button when you're applying. So you must submit your application, so to speak. But you don't have to necessarily change anything within the portal. You'll just have to go in, validate, and then hit the submit button. Okay. Let's see. I think that's it. Okay. So moving on to open enrollment. So we have scheduled a June 12th webinar. This registration link here, you can easily go and register for it. We are also going to start sending out email reminders for this as well. This is going to walk through the application process step by step. Again, as I just said, we have made enhancements this year in the portal for the PY6 application cycle. So it's really important that you attend this webinar to understand how these enhancements are going to work. Okay. I also want to bring your attention here to the EQIP entity portal when open enrollment will begin and when it closes, because the dates are going to be a little bit different this year than they have been in prior years. The enrollment is going to open on June 29th, and then we will close enrollment on August 21st. Not the 31st, as it's typically been historically, but the 21st. And the reason behind that is that it's going to give us a 1-week window to review all the applications that are in the portal. It'll give us time to fix any issues, and make sure that we have all of that taken care of so we can then timely submit the information to CMS. The August 21st deadline is final. There will be no extensions granted. So if you do not at least submit an initial application by the 21st, you will not be eligible to participate in PY6, and there will be no exceptions made to that. So we strongly encourage you to plan ahead and avoid waiting until the last minute to apply. I think I have another question here. Oh, that was Jean, sorry. Okay. All right, moving on. Pre-enrollment form. So let's walk through what this pre-enrollment form is. This is one of the new tools that the EQIP team has created that will hopefully help make enrollment a little easier, especially for new entities and for new people who are new to EQIP and CRISP in general. This form is required, but only for certain organizations. Again, organizations that are both new to CRISP and or EQIP, or organizations that want to create a new entity in PY6. So if your organization is already participating in EQIP and you are continuing with the same entity, you do not need to submit this form. Okay, you'll just need to go into the application portal, make sure all your information is correct, and then hit the submit button. I want to clarify that this pre-enrollment form is not the application. Submitting this form does not mean you have applied to EQIP. It's just simply a step that allows us to get your organization set up in all the necessary back-end systems so that you have all the accesses you need and can apply during the open enrollment season. And the sooner you get this in, the faster you will get your access. Again, we're going to talk about the deadline for this form is going to be August 7th. And you are required to complete this step if you're new to EQIP, CRISP, new entity. Again, I've explained because there's a lot of things on the back end. This form will help us get you set up in the HIE portal if you don't already have it. It will enable us to give you and any of the people on your list their EQIP access to the portal. And then that way you can get everything set up and ready to go to apply. It gets you through the application process in a smoother process than prior years. How to submit this form, you can find this form on our CRISP website here, and I've also linked the form here on this slide deck. If you have any questions whatsoever, any issues whatsoever, always please reach out to the EQIP inbox first. We are happy to help you through any of the issues that you may be having or answer any of your questions. Okay. Now, the MPI summary file. Let's take a closer look at this. As I mentioned earlier, this is one of the key ways that you can access information on eligibility before you even go into the EQIP portal. What is this file? It's a standardized data set that summarizes your EQIP episode information at the NPI level for the baseline year, which is 2019. It provides a consolidated view of all the episodes associated with an entity, with the entity's NPIs during that baseline year. So basically, it gives you a clear view of your organization's historical activity. So why would you want this? Why would you request this file? Well, it helps you understand which EQIP episode categories you are eligible for based on your episode volume. Secondly, it allows you to identify which NPIs have touched at least one claim during the baseline year, which is critical for participation. It also helps support entity structure decisions, helping you to determine which providers you want to include within your entity. And more importantly, it's going to help you evaluate whether or not you meet the 75% threshold requirement, which is critical for eligibility also, right? So again, 75% of the NPIs have to touch at least one claim of the episodes that you are participating in on the baseline year. Any questions on this? There is a template that we ask that you use. I've linked it here. You can also find it on the CRISP website. Does anybody have any questions on the two tools I've gone over so far? Okay, moving on. All right. Now we've talked about CRISP onboarding earlier. I've touched on it just a little bit, but I want to make sure that you're fully understanding what I mean when I say fully onboarded with CRISP. So to participate in EQIP now, I know historically it wasn't always this way, but it is now for a couple of reasons. So to participate, all entities must complete these onboarding steps. And this will happen after the application cycle has closed and your entity has been accepted into the program. You will be assigned an account manager from our outreach team, and they will contact you to get the following steps moving along. So the first thing that you have to do is you'll have to sign a participation agreement with CRISP. This agreement is required because the EQIP portal is now within the CRISP HIE system, which contains PHI information. So appropriate legal and privacy protections, they have to be in place before we can grant any of the other accesses. During this beginning process, during the application process, you will only have access to the EQIP portal. You won't have access to anything else. Another key component of onboarding is now we are asking that every entity submit a patient panel. Okay, so there is a patient panel requirement. I know this was not required before. I hope it's not going to upset anybody, but I need you all to really understand EQIP in and of itself is a value-based care program. And we also now have a new quality measure, which we talked about at our last subgroup meeting, that now is, key to the reason behind this patient panel. Entities are required to submit a patient panel every 90 days. What this patient panel does, it'll allow you to track and monitor your patients across care settings. And specifically, it gives you visibility into ED and inpatient ED visits and inpatient admissions. And these two things alone, these two sections alone, can cause utilization costs to go through the roof if you're not paying attention. It's critical to understanding your patient's activity and utilization in real time. And why does all of this matter? Again, at its core, proactive patient monitoring is fundamental part of value-based care. Providers should always have awareness of care events related to the patients and the conditions that they are managing, not just within the setting that they're managing it in, but across all continuums of care. And this panel is key also when we think about the new quality measure that is being implemented, and that is the all-cause unplanned hospital-wide readmission measure. It tracks high-risk patients. It identifies and helps you maybe to prevent avoidable ED visits and hospitalizations. And ultimately, if you are doing your due diligence, will help reduce costs while improving patient outcomes. So bottom line, being fully onboarded is not just a technical requirement. It also ensures that you have the tools and the data accesses and the visibility needed to actively manage patient care and succeed in value-based care model. Now, I see we have a couple of questions in the chat. Let me just review that. What is the difference between pre-enrollment versus the pre-enrollment form is only, again, if you are a new entity who is new to EQIP, new to CRISP, or if you are creating a new entity. Open enrollment deadline is the 21st, that's the last day you can submit any application in the EQIP portal. Hope that answers your question. Okay, Dr. Mitchell, you said, what if you're a hospitalist or an ED group? Can you explain more what your question is related to? Do you want to come off mute?
Yeah, I mean, when you say, submitting a patient panel to avoid ED visits and inpatient admissions, I mean, that's sort of what we do.
So if you're doing it
So I just,
already,
well, yeah, so we would just admit the admissions from the prior year that we've taken care of that that are included in our panel, or because we don't really have a panel that we take care of. We have
gotcha.
whoever comes in. Yeah.
Gotcha. I think, the account managers can certainly help you with all of that. I think it's really, that's a very good question. I think
Kim,
that, go
we
ahead.
might want to take that back to the policy people because the ER bundle is a bit of a problem. We should
Yep.
just
Yeah.
ask them and
Yep.
maybe,
Yeah, because the whole
but
thing about ED, there's a whole ED measures, I mean, it's so.
Right.
yeah, so we can ask if there maybe is something else they could do in lieu of that or something.
Correct.
Okay.
Yep.
We'll ask
Absolutely.
and come back next meeting if that's okay,
Yeah.
Dr. Mitchell.
Yeah, that's cool.
Let's see, Stephen, says, as the HIE, does CRISP not already have the claims for these patients? What exactly do we mean by a patient panel? So Stephen, basically submits a panel monthly anyway, I think, if I'm not mistaken. It's kind of like an automatic thing. I think you guys are already set up. And it essentially is just a matter of who are your patients that you are seeing, right? Who are the patients that are currently under your care? That is the patient panel. So for your independent entities that you guys have put together under I would then suggest saying things like, what specific patients are you seeing, right? That are coming to you on the regular? What patients are you currently seeing right now that maybe you are doing not an episode, I'm sorry. Whether you're acute or you are procedure based. Those are the patient panels that we're looking for because you want to monitor those patients. You want to keep an eye on those patients and making sure that they are, outreaching back to the provider who provided those services rather than running to the ER or that sort of thing. Kelly says, we were notified yesterday that CRISP is having issues with the panel loading and will take several weeks to fix. How can we? So that's a separate situation. Obviously, if CRISP is having issues, we're not going to penalize you, right? Like we're not going to, that's not a thing. So the bottom line is, are you making a good faith effort? I hope that answers your question. Matt says we send CRISP a panel biweekly and an MDPCP panel specific every 90 days. Want to make sure since our entities are created under our 10. Again, I would make sure that whatever panels you are sending in are inclusive of any patients that you would be seeing under the EQIP program. And if that is the case, then absolutely it satisfies that.
Perfect. I'm sorry, Kim, I just had to come off of mute. But yeah, we send an all patient panel. So
Okay, then you're covered.
Perfect. Okay, thank you so much.
Yep, absolutely. If we have to submit patient panels, will we be able to see which patients are getting included in quality metrics denominators? That's a really good question, Rupa. I can certainly take that back to the data team to see if that's something we can include. Let me write that down. You are not the only person who has asked for the patients to be included in the quality measures. Okay. Okay. So, oops. I'm so sorry, guys. I don't know what just happened here. Can you all still see my screen? There we go. I think I got it.
Yes, we can see it.
Yes.
Okay, sorry about that. I don't know what happened. Okay. Renee says 2019 is 7 years ago. We have several current providers who were not employed with us 7 years ago. They will not have claims in the baseline period. Please speak about this issue. Is consideration being given to updating the baseline? So we have been in talks about trying to update the baseline with I guess with everything that's been going on with the AHEAD program, this has sort of been put on the back burner for the moment. But I do understand your concerns. I think it is something that, I mean, it's a very valid concern. And it's definitely something that we are still kind of talking about. I don't have an answer for you at this very moment. Krista, I saw you just come off mute. Do you want to speak to this a little further?
Yeah, I mean, I was just going to say I agree with Kim. I think there's just so much going on, and I think we'll probably revisit it next year, recognizing that 2020 was a weird year, 2021 so we're trying to figure out the best approach to changing the baseline, and so definitely hear your concern, and I think we will be looking at that probably potentially for next year. So yeah, that's all. Thanks, Kim.
Absolutely. Okay.
And some of that, obviously, Chris, is going to depend on the politics of everything and how things move forward too. So, I mean, I think we just need to level set with everybody that we're dealing in a very uncertain situation politically, and that's putting pressure on all of these kind of transformation programs.
Yeah, absolutely. Thanks, Jean. Yep.
Thank you, Jean. Appreciate that. All right, so moving on, I'm going to turn this over to Angelica, and she is going to talk through the new PY6 episodes. Angelica?
Yep. All right, so next slide.
Mm-hmm.
All right, so we are for the episode development process, we are currently in the recruitment and episode education phase for PY6, which is calendar year 2027. And next slide. We have 23 new episodes that have been finalized, and the PY6 episode playbook is in development. Episode definitions are also being finalized, and once that's complete, we'll share that broadly with everyone. And in the following slides, you'll see the new episodes bolded and highlighted in blue, organized by specialty for easy reference. So if we go you'll see, like for cardiology, there are a couple that are bolded in blue. Those are the new episodes for that specialty. And in the next couple of slides, you'll see the the additional episodes that we've added on. And when you get the slide deck, you will have access to all of this. So yeah, I'll go ahead and pass it back to Kim. Do we have any questions about that?
Any questions about the episodes? All right, moving on. Thank you so much. Okay, now we are going to go into the new quality measure. So the next few slides are basically calling out the quality measures that are being implemented in program year 5 and will then continue into program year 6. I'll start by walking through the newest quality measure that essentially has been mandated by CMS for us to employ in the program year 5 EQIP program. So also want to call detail to you all. You're going to get all of these slides. These links right here in the title, these are the links to the actual CMS definitions. I have done that link for each and every one of the quality measures, as well as broken it down into kind of soft explanatory means. So,
Kim,
yes,
I think we're not able to see your slides.
you cannot?
No.
I can see them.
Oh dear.
Well, let me see. It's showing Gabrielle Sardi's screen for some reason. Let me see.
Oh, yeah, it
Okay.
says regulatory requirement.
No. Okay, hold on. Let me stop sharing 1 second. Oh, I see someone else is sharing their screen. Who is that that's sharing their screen? Olivia, can you? Thank you. All right, here we go. Let's try this again. Okay.
I think we all just saw top secret potential regulations from somebody at DH, Department of Health.
Okay. Can
Somebody
everybody
gets
see
points
my
for paying
screen now?
attention. You're right.
Are you seeing the all-cause unplanned hospital-wide readmission?
Yes.
Yes. Perfect. Okay, wonderful. So, okay, let's move on here. So, the all-cause unplanned hospital-wide readmission measure, or HWR, because that's how CMS brands it, is again being instituted in this year, program year 5. So, what is this measure? At a high level, this is the rate of unplanned hospital readmissions within 30 days of a patient being discharged from an inpatient stay. It focuses on Medicare fee-for-service beneficiaries, 65 and older, and it is calculated using claims data. Something else to point out is that this measure is risk adjusted, meaning it adjusts for differences in patients' complexity so that comparisons are fair across providers. Unplanned readmissions are often a signal of gaps in care. Krista, did you have something to say?
Oh, nope. Sorry, I was just clearing my throat. Sorry.
Unplanned readmissions are often a signal of gaps in care coordination, especially during transition out of the hospital. This measure encourages strong discharge planning. It encourages better care coordination across all settings and ultimately a better patient experience. It is also important to remember that readmissions are costly, and reducing avoidable readmissions is the key goal in any kind of value-based care program that you are in. So how does the scoring work? How does it work? So the denominator that includes eligible inpatient discharges. The numerator, that captures any unplanned readmission within 30 days of the original patient discharge. Planned readmissions are excluded, okay? From there, the results are risk adjusted using clinical and comorbidity factors and a standardized readmission ratio calculated. At the entity level, those results are aggregated into one single overall score. There's another slide here that goes into a little bit more information on this. So we'll move to the next slide. Because a key part of how this measure is calculated is through something called specialty cohorts. Specialty cohorts are not used to score you separately. They are used behind the scenes to make fair comparisons. So what is the purpose of these cohorts? Essentially, it ensures that providers are being compared to similar clinical cases. For example, a cardiology case is going to be compared to other cardiology cases, not to an unrelated surgical case. So there are 5 CMS-defined cohorts, and they are cardiorespiratory, cardiovascular, medicine, neurology, and surgical/gynecology. It's also important to understand how these cohorts are applied. So the cohort assignment is based on the type of admission, not the provider specialty. So a single MPI may actually contribute to multiple cohorts, depending on the type of patients and episodes that they're treating. And each cohort is modeled separately, and then the results are combined. So how does everything roll up? All of those cohort level results are first combined into a single score at the NPI level. And then each NPI is then aggregated into one overall entity level score. So even though a lot is happening behind the scenes with your cohorts, you're going to ultimately just receive one score. And the overall goal here, again, remember, value-based care, is we want to have fewer unplanned readmissions than expected, given the clinical risk of the patients you are treating. Okay, so before I move on, I see I've got 2 questions in the chat. Kelly wants to know, going back to the baseline data, if the physician isn't a part of the baseline, how are they being evaluated in the program? So if they are what we call probationary providers, I don't even like using the word probationary. If they don't have a claim in the baseline year and they are still participating because you meet the 75 or 50% threshold, they're still being evaluated the same. It's just part of the actual policy is to have at least 75% of your providers who have a claim in the baseline year. Hope that makes sense. Would you please clarify observation admissions included in this or not? I hope no, because they are outpatient status. You know what? Charlotte, let me take that question back to the data team. I'm not 100% sure that I can answer that today, but I can certainly take that back and make sure if and how that is validated. And then another one, it says, how are planned readmissions identified by CMS? That's a good question. I don't know all the ins and outs on that, and I can go back and get that information, but I would imagine if it's a planned thing, you are already going through your processes of, getting set up to, to have admissions, right? So like, let's say you're having a knee replacement done, right? You're going to have to go through all of that, all of the pre-admission stuff to, I'm sure that's part of it. I don't know the rest of it. I can get you that information. Okay, I was just using an example. Sorry, I can and make sure that I get you that information. Let's see. Just to confirm, the 5 clinical cohorts are only for the risk adjustment component. Providers that do not fall into those categories are still. I'm not sure I'm following what you're asking, Rupa, but please, I would explain that a little bit more and throw it into an email and send it to me. I'm happy to investigate that for you and get you further information. Okay. All right. Moving on here. The rest of the quality measures are the same as the ones that we've already had. We have advanced care plan. We have the documentation of current medications in the medical record, and then we have the BMI screening and follow-up. I've added these to the slide deck for you with the links to the actual CMS definitions, just for your ease of use and convenience. Okay. Any further questions with regard to the quality measures before we move on? Excellent. Data release schedule. Here are the tentative data release schedules. The episodes that are coming should be about the 22nd of May. Estimate, again, not solid deadline, but estimate. Will be the episodes ending in December of 2025. The baseline data is already in the portal. That was put in on the 4th of May. And then the episodes that are ending in January of 26 will be in the portal in June. Okay. Again, please understand that all of these release dates are tentative. Things are subject to change due to a multitude of different reasons, including when we receive the data, if there's all the data that is in, we don't have to go back to CMS for anything, etc. So there are a multitude of reasons why it might be a little later than normal. All right, now we're going to move on to payment information for PY5. Today is the deadline to make sure that you have submitted the supplier registration form that was sent out to every single entity by the finance department at Meritus. So every payment recipient should have received an email from equip.finance@meritushealth.com requesting that you complete the supplier registration form. This is critical. This form is critical because this is how Meritus, the new CRP, will be paying any EQIP recipients who have received savings. That's how you'll be getting paid, is this information, utilizing this information. I really want to emphasize the timing here. Today is the deadline, and this information needs to be submitted by midnight tonight, okay? If you have not completed this information yet, please do it as soon as you possibly can today to avoid any delays in payment. Essentially, again, you should have received an email from the equip.finance@meritushealth.com with step-by-step instructions on how to go about registering in the site. You'll need to download and complete the IRS form W-9. You'll have to upload that form into the registration portal and then provide your banking information, because we will not be doing checks for PY5 payments. PY4, you're still going to be receiving a check. PY5, so this time next year when we're doing our finalization, actually it'll probably be more towards the fall, sorry, when we're doing the finalization, you're going to be getting a direct deposit into your bank account. It's not going to be a check, okay? Make sure that you keep all of your information up to date in that portal. If anything changes, whether it's banking details or organizational information, you should notify us at the EQIP team, at the EQIP inbox, and then log into your supplier registration system and update that information promptly. If you did not receive this email or you're having problems accessing the system, please reach out to us at the EQIP inbox immediately so we can assist you today. Because again, today is the deadline. All right, now we're going to talk about the CRISP Annual Summit. So the CRISP Annual Summit is happening Tuesday, the 19th. Topics will include telehealth, rural health, and then several new CRISP features that are happening. If you have not already registered, please use the QR code here on the slide to register, and we encourage everyone to attend. There's a lot of new information that's coming out this year, And some of it will be useful in helping you manage any value-based care that you are currently enrolled in. As always, we've supplied you with our resources slide here with the links to different resources. And that is it. I'm going to open it up really quickly for any last minute questions.
Go ahead, Victoria.
Good morning. I had a few questions. Just going off of what you had just discussed about the EQIP supplier registration deadline. So I know that there were a lot of emails that were sent to lead care partners as well as the admin proxies, and then ultimately those emails from the Meritus Health Finance email went directly to the payment remission recipients. So is Chris going to inform lead care partners, because we've been getting a lot of emails from lead care partners to just ask if the process has been finalized, and even from admin proxies too, about whether Meritus Health has actually approved their request or not. So is there going to be an update email to let people know once Meritus Health has completed that process of approving the submission, that there's no more action required from them?
I can certainly touch base with Meritus and make sure that that happens. Yes.
Okay, thank you.
Yeah.
And then my second question was about the data release schedule.
Yes.
So in years past, sometimes with the reconciliation, because the year-to-date December 2025 data is supposed to be released or anticipated to be released by the end of this month, is there going to be any updates to the reconciliation that are anticipated, or should we anticipate that the reconciliation release at the end of this month is final?
That's a very good question, Victoria. Thank you. I probably should have added that to the slide and I didn't think about it, but it should be updated at the end of this month also for the reconciliation. Yes.
Okay. So that should be final.
It
Because
should
I
be.
know last year. Okay. Okay.
Yes.
Thank you.
Yes. Any
And
other?
then, sorry. And for
That's okay.
the unplanned readmissions quality measure for
Mhm.
the data mapping, is that still being in process by Chris? Because I know that was discussed at the last meeting.
Yeah, so the slides that I presented today, that is how we are mapping it out, the categories and everything that I went through on those slides. That is the mapping. That's how it's going to be done.
Okay.
So if you have direct questions, I would, if you wouldn't mind, if you could throw that into an email with regard to that, and then I can get those answered, because a lot of that information is stuff I will have to end up going back to the data team on anyway.
Okay. Thank you so
Okay,
much.
absolutely. Anything else? Any other questions? Okay. If I missed any of your questions, again, please throw it in an email and send it to the EQIP inbox. We are happy to answer your questions. And in the meantime, if there is anything else that you need, again, whether it be in regards to what we talked about today, enrollment, etc., always please feel free to reach out to the EQIP inbox, and we'll get back to you as soon as we can. Thank you all for your time today. We absolutely appreciate your continued engagement, and we look forward to working with you all in PY6. Thanks so much.
Thank
Thank
you.
you.